Welcome to this video. In the next few minutes, we will show you how to safely and easily perform a drainage using the EavyMed drainage set. Before you begin the procedure, make sure to prepare the following essential materials: the drainage set, an alcohol-based surface disinfectant, a hand disinfectant, and a pair of disposable gloves. Begin by preparing a clean workspace on a table and thoroughly disinfect it using an effective surface disinfectant. Please wash and thoroughly disinfect your hands using soap and water and then put on the gloves. You have either a short catheter, which is clearly visible on the left side of the image, or a longer catheter that is neatly rolled up on the slit compress located on the right side. The following drainage instructions apply to both options. First of all, carefully remove the dressing that covers the catheter. Please exercise caution and avoid tugging on the catheter. Always avoid using scissors or any other tools for this particular task. If you notice any signs of redness, swelling, or fluid accumulation, please inform your treating physician as soon as possible for prompt attention. Then remove the gloves and thoroughly disinfect your hands once more. Please open the drainage set and then set the gravity reservoir aside for later use. Open the dressing material set and gently spread out the blue drape, ensuring that the flap is facing upward. Please exercise caution and avoid touching the inner surface of the drape. Open the packaging of the drainage set and take out all of the contents inside. It is crucial that the access tip at the connection tube stays completely sterile. Hold the gloves by the opening and slide them onto your hands. Make certain that the glove does not come into contact with any non-sterile objects during the procedure. Open the packaging of the alcohol swabs without actually removing them from the packaging. Carefully remove and properly dispose of the silicone or protective cap that covers the catheter. Insert the safety valve into the packaging of an alcohol swab and then clean it with gentle twisting motions. Please allow the disinfection process to take full effect for a duration of 30 seconds. Close the clamp on the connection tube. Remove the protective cover from the access tip using a slight twisting motion. Remove the alcohol swab from the safety valve and then insert the access tip into the valve. You can hear and feel it click into place. Always ensure that the reservoir remains positioned below the catheter exit point, as effective drainage relies on the force of gravity. Now open the clamp on the connection tube in order to initiate the drainage process. You may experience an uncomfortable pulling sensation during the drainage process. Close the clamp on the connection tube to pause the fluid flow temporarily. If you experience severe pain, be sure to stop the drainage completely. When the drainage volume recommended by your doctor has been reached, stop the drainage by closing the clamp. Disconnect the safety valve and the connection tube. Insert the safety valve back into the packaging of the alcohol swab and clean it again, ensuring you allow a full 30 seconds of contact time. Open the packaging of the protective cap from the drainage set and let it drop onto the blue cloth. Attach the protective cap to the safety valve. Read the drainage amount directly from the bag and document it in your drainage record. Before we begin applying the new dressing, please select the instructional video that corresponds to your catheter type. You can easily identify the correct video by looking for the thumbnail, which prominently displays the corresponding catheter. You will still need to keep all the utensils you prepared in this step for the upcoming stages of the process.